Hi guys! So today I'm going to talk a little bit about Sjogren's syndrome, and I've made myself some notes because I am prone to getting off on a tangent and I can't make any promises here, but I'm going to try and talk about just Sjogren specifically for a little while. So Sjogren syndrome, if you have it, I'm sorry, it sucks. Sjogren's really sucks. It is an autoimmune disease that affects your entire body, along with symptoms of extensive dryness. Other symptoms include profound fatigue, chronic pain, major organ involvement, neuropathies, and lymphomas. Although many people are going to experience the biggest symptoms, the classic symptoms, are dry eye and dry mouth. And by that, I don't mean like cotton mouth. I mean severe. I mean, it's above and beyond anything you can imagine if you don't have it. You're also going to have other problems. And it not always as dramatic, but it can cause dysfunction of your organs, such as your kidneys, your gastrointestinal syndrome, blood vessels, lungs, liver, pancreas, and your central nervous system. There's a lot of statistics about Sjogren's like any other disease, but the one that always stands out to me, there's two of them, but one of them is that 9 out of 10 people with Sjogren's are female. That's really, really shocking. We don't know why. The other thing is that it's very hard to diagnose because it mimics lots of other diseases. Half of the time, Sjogren's appears alone, and half of the time it appears with other autoimmune diseases. It's very common with lupus, for example, RA. There's several other diseases that there's lots of things you can have with Sjogren's, but there's several autoimmune diseases that Sjogren's really likes to play with. They play well together, which is unfortunate for anyone that has to deal with it. But on average, it takes 3 years to be diagnosed with Sjogren's because of that. And that seems like that is a long time because in the meantime, you're not being treated for it, but also it's causing complications. But that actually isn't that long because lupus, for example, can take up to 10 years plus. Endometriosis the same. I'm thinking of things that have affected me so offhand, but it's very common for these things to take a long time to get properly diagnosed, no matter how many doctors you're seeing. But early diagnosis and proper treatment are imperative because this is causing damage that is not fixable the whole time it's not being treated. And you really want to prevent serious complications and obviously improve your quality of life. Sjogren's dramatically decreases your quality of life, especially when your symptoms are not under control / being managed. What's going to happen with Sjogren's? A lot of things are going to happen with Sjogren's. Like I said, the main thing is you cannot produce saliva, and it affects your moisture-producing glands. So you're going to have serious dry eye and serious dry mouth. For me, my salivary glands are always swollen and painful, always. So these glands here, right here, hurt. And because they are always swollen and painful, and my lymph nodes, the pain and the constant swelling causes pain all the way down here. Just touching it hurts so much. This is swelling from the swollen glands, and then the pain comes here on both sides and here. The best way I can describe it is it feels like I'm being choked like this, and like someone is applying constant pressure and just choking me tighter and tighter and tighter constantly. So it is always there. It always hurts. It's going to get more uncomfortable the more I talk. And it doesn't really matter how yappy you are, and I can be very yappy, but you're going to have losing your voice every day is common, hoarse voice, and sore throat, dry cough. All of these things are super common with Sjogren's and difficult to manage. I only have so many hours a day that I have my voice. even when I'm not running my mouth extra, and I'm good at running my mouth sometimes, but I don't have to be running my mouth extra to lose my voice. And the more I talk, the more intense this pain is going to become. When I had my very first serious flare-up, my face was out to here, my neck was out to here, and I was in the hospital. And I got to see a ENT that was a very difficult specialist to get into because he was very good and very well known and well respected. Very smart man, very no nonsense. And the first thing he said to me after, tubing my mouth and nose to make sure I was going to be able to breathe and to see what was going on, he said the only people that have this problem, he didn't specifically refer to Sjogren's, but lupus, he said the only people that have this kind of swelling in these muscles and this kind of pain, and he could feel the swelling, obviously he could see it, but he could feel it and see it, he said are people with lupus and opera singers, because with lupus there's constant inflammation and irritation, which causes the strain, the swelling, the pain, and obviously opera singers are overextending themselves and using those straining their vocal cords and these muscles to an extreme level that anybody, even yappy people and motivational speakers, don't do. So it's something you only see in these cases. And he was a really great doctor, and while he couldn't fix it for me, he did say this is, the only management is to deal with the disease the best you can. Some other things you're going to have to deal with, possibly gastroparesis is something I've had to deal with myself. I have to deal with. Yeah, you got no fluids in your body. Things are not working. It's super dry, and drinking water is not going to fix it. So your stomach and your digestive system are going to slow down. They're not going to work properly because there's not enough moisture and they're not getting proper signals to work. Oftentimes you will vomit and not even digest your food because the signal's not being sent and nothing's happening. So gastroparesis is a whole different situation, and not going to get into real specifics on that, but it is something that you may end up having to deal with. Obviously, dry skin's going to be a huge issue. Difficulty chewing, difficulty with speech, dry nose bleeds. You're going to lose your sense of taste and your sense of smell. They're going to be dulled or gone. There's really no way to avoid that. The damage is going to cause that, and it's going to happen to some extent. I think it's just a matter of how much. Neuropathy is something you're going to have to look out for. Numbness, tingling in your extremities. You're going to have to look out for recurrent bronchitis, pneumonia, infections, brain fog. You're going to have neurological issues, difficulty concentrating. Those are pretty common as well. And then some other serious things that you really need to look out for that are not always going to happen, you just want to watch for and prevent, are interstitial lung disease and kidney problems. Okay, how are you going to deal with your Sjogren's? So what's going to happen? It's difficult to deal with, but you are going to need to work really closely with your doctors. You need a good rheumatologist, a good GP, and you need a good eye doctor and a good dentist. And everyone that's not good, you need to dispose of and move on till you find a better one. Because, like I said, this is seriously going to impact your quality of life. You are going to deal with major tooth decay no matter how good you take care of your teeth, and you're going to have to do a lot of things to try and prevent it, but it's going to happen anyway, and you're going to have serious problems with your eyes, and you need to take care of them. So you're going to need a very good dentist and a very good eye doctor and a very good rheumatologist. You're going to need eye drops. They have to be preservative-free. Drops with preservatives are going to make your eyes worse. So preservative-free drops, sometimes over the counter, are going to work for you, that's fabulous. There's all different kinds. Most likely you're going to end up needing Restasis or a prescription eye drop, the cyclosporine that your doctor is going to prescribe to you. That's going to help you. You're going to need to use an eye wash, and heating packs. Heating packs help because you're going to get, some people, not everyone, but some people get reoccurrent eye infections. You really need to watch what you're putting on your eyes. I can't wear eye makeup as often as I'd like to because it sometimes bothers me. It depends if I'm in a flare or not. You're going to need to do something about your mouth. So I take Sjogren, which is a medication that helps you make saliva. I take it 4 times a day. There's different doses, obviously. I would not be able to function without it. Also, sour candies. I hate them. Lemon drops are not my favorite thing, but they do help prolong my ability to speak. So they're definitely an important and invaluable tool. Sugar-free gum can help you. I'm not a gum chewer anymore, but it can help. Of course, drinking lots of water is something you're going to do regardless, but it's going to help, but it's not going to relieve your dry mouth. When I had my very first flare, I thought I was dying. I drank 24 cases of water in a day, and I called my rheumatologist. I said, I'm dying. And he's like, no, it's the flare. He increased my prednisone and my Sjogren over the phone, but I literally thought I was dying because it wasn't relieving my dryness at all, and I was literally horrified. The other things that are likely to happen is that you're going to be put on medication. You may end up on an immune suppressant. If you do not have another autoimmune disease that you are currently on an immune suppressant for, then this will be new to you. If you already have something else like lupus or IBD, you're going to be on an immune suppressant or biologic already. I take immune suppressants. I take Imuran and prednisone, and I take also biologic. I take Humira right now, taken many other kinds. Methotrexate is a medication that works very well, and I will be switching to that soon over Imuran. It's a scary medication. I'll talk about that some other time, but it has been known to help a lot. Also, Plaquenil, which is something that is an anti-malarial drug and super common for you to be taking if you have lupus, and it can help with Sjogren's as well. So these are things that your rheumatologist will talk to you about and may prescribe for you, and they can be very beneficial and help you. You're going to need to manage your pain, and they're probably going to tell you to take over-the-counter pain medication. It's probably not going to help. So you're going to need to work with your doctor for pain control. Sometimes over-the-counter medication helps. I'm not saying always, but all the time. Heating packs are going to help a little bit, sometimes cold. For if you have the pain that I have, caused by these muscles, your rheumatologist is going to probably give you muscle relaxers. The problem with muscle relaxers is they often are going to flare your Sjogren's. They're going to make your dry mouth worse. So you're going to have to play around with which ones work best for you. They can be helpful though, so it is definitely worth trying. Of course, they can make you very sleepy, and a lot of people can't tolerate them during the day. They have to work and function. But it's just one of the many tools that are going to go in your toolbox. And you're going to need to save your voice. So you're going to have to rest your voice sometimes. That's going to also happen because you're going to lose it sometimes. And what else? So these are the main things that you're going to be able to do to try and manage the symptoms of Sjogren's. They are far-reaching and they can be brutal. And if anybody, like I said, has any things that have helped them that they might find that might be beneficial to someone else, please make a comment, because you absolutely never know. And this is something that you need to be really proactive with, and with your doctors, but also for yourself. because, like I said, it seriously will decrease your quality of life. And you really want to try to minimize your symptoms and maximize your comfort levels to the very best of your ability. It's super unpleasant to deal with. It's a very miserable thing to have, and I wouldn't wish it on anyone. But we try our best to deal with this every day and to minimize our suffering with this disease. So I hope this has helped a little bit, whether you have Sjogren's or especially if you're newly diagnosed. Just know you are not alone. There's tons of resources online, and I urge you to educate yourself on it, because the more educated you are, the more empowered you're going to feel, and the better you're going to feel, and the better you're going to be able to understand and relate and talk to your doctors. And that is all just going to help you as you deal with this. It is not curable. You can't make it go away. So really just trying to manage it the best you can is what you're going to need to do. Just the most education you can offer yourself and trial and error of things to give you some relief is the best advice I can give you. And I hope remission for everyone, and if not, I hope medications that offer relief and some of these other little tricks, because anything that helps, even just a little bit, totally worth it. So good luck.